Hello friends, this is physiotherapist Dr. Shruti Parekh working in Advanced Knee and Shoulder Hospital run by renowned arthroscopic surgeon Dr. Prathmesh Jain in Ahmedabad, and we have with us Dr. Himanshu Patel. He is an orthopedic surgeon working with us. So these days we are discussing about the most common disorders, and after the overwhelming response that we got for plantar fasciitis, we have come up with the topic today is tennis elbow, and that is also known as lateral epicondylitis in medical terms, and in layman term it is known as tennis elbow. It is the pain over the lateral side of the elbow joint, that is the outer side of the hand in the elbow joint. And today we'll be discussing about the most common symptoms, what are the causes of tennis elbow, what are the investigations can be done, and what are the treatments. So let's know about what is tennis elbow.
Tennis elbow is a inflammation of the extensor muscles of the elbow, where the patients have the pain on the outer aspect of the elbow joint or the lateral epicondylitis. So whenever the patient pull up any heavy weight, lift any heavy weight, they have the pain over the lateral aspect of the elbow joint. We call them as a tennis elbow or the lateral epicondylitis of the elbow joint.
So these are the most common symptoms while lifting weights,
lifting heavy weight, or
while
like
extension movements.
Yes, extension movement, or doing some driving motor two-wheelers. Also the patients like sports persons. The tennis elbow are more common in sports person like cricketers, baseballers, and in some patients, if they have the blunt trauma over the lateral aspect of the elbow, they can also develop the lateral epicondylitis or the tennis elbow.
Okay. Well, how can we investigate that a patient has a tennis elbow?
Basically, the tennis elbow can be diagnosed by the clinical test, okay, and then another investigation is the MRI. In clinical test, we ask the patient to extend the wrist against the resistance. If the patient feels the pain over the outer aspect of the elbow or the lateral epicondylitis, then it is a tennis elbow. Other is the extension of the finger against the resistance. There are some clinical tests like this, and other is the MRI.
So doctor, whenever you go to a doctor, he will perform some clinical tests on you, and then he can investigate whether you are actually having a tennis elbow, and also you can investigate on an MRI, right? Okay, what are the treatment options?
Treatment options, initially we treat the patient conservatively. We give some painkillers, medications, and some ice application. Also we advise them some physiotherapy exercises and modalities like ultrasound over the local part. And if the patient have the persistent pain even after this medication and physiotherapy, we give them either steroid or the PRP therapy for the lateral epicondylitis.
Okay. And what are the surgical treatment options if all these don't work?
Tennis elbow is an inflammation of the extensor muscle, mainly the extensor carpi brevis tendon. Okay. So in surgery, we have the two options. One is the open surgery, where we incise over the lateral aspect of the elbow and we release the muscle from the bone or the subterraneously. And second one is the arthroscopic, where in which we are doing the same procedure by arthroscopy. So
okay.
It is only 2 or 3 stitch incision.
So arthroscopy is just a keyhole surgery. It doesn't open the joint.
Yes.
Okay, and the physiotherapy treatment that can be given for tennis elbow is at the elbow joint, a patient can perform flexion and extension movements. They can also consult a registered physiotherapist for the same. Weight training for elbow extension and flexion movements and modalities like ultrasound are useful. And in elbow movements, we can be doing some bicep curls and hammer curls, and also we can be doing some wrist movements which can also help the elbow joint. So the extension movements and flexion movements at the elbow joint are more important. Gradually patient can shift to weight training and along with ice application and physiotherapy modalities. Ultrasound should help more, but again the usage of ultrasound should be limited. It can be just given for maybe 20 to 25 days, not more than that. Thank you very much.